Are you experiencing pain in the shoulder that occurs on the top, or it goes down the side? It might even come down the front. Is the pain on your shoulder keeping you from sleeping at night, or you can't even sleep on that shoulder? You may have gone to your doctor and they diagnosed you with subacromial bursitis, but what does this mean? Well, today we're going to break down subacromial bursitis, and I'm going to show you how you can test this at home and 5 exercises you can do in order to decrease the shoulder stiffness and pain. Welcome to Better Mobility, Better Life, where you can learn how to break mental and physical barriers to become a better athlete, a more functional human, and how to age with grace using physical therapy techniques. Okay, so you are getting pain that goes on the top of your shoulder, and sometimes it goes down the side of your shoulder. It could even come on the front. And a lot of times you're getting this when you're reaching overhead, you're coming out to the side, or behind the back. You may have irritated some of the structures that sit underneath that shoulder blade. When you look at the anatomy of the shoulder, you have a thin fluid-filled sac that is located between the rotator cuff tendon and the deltoid muscle on the top part of your shoulder here, and that's called the subacromial bursa. If that is pinched repeatedly, most likely with repetitive overhead movements or out to the side or behind the back, it can become inflamed and swollen, and this is known as bursitis. Just note that there is also a tendon that goes right above that bursa that can also be irritated and be a result of tendinitis, but it's very hard to differentiate the difference. Here are a couple tests that you can perform quickly at home to find out if you have subacromial bursitis. Please note that this information is purely educational and not medical advice. There are many causes to shoulder pain, so use this as a guide. If your shoulder pain persists, I advise you to see your trusted PT. For the first test, you will put your hand of that same shoulder on your good shoulder and you'll lift that elbow up in the air. If it's painful, then the structures such as the bursa, they run out of space and they get irritated, and that will result in your pain. The second test, you would put your hands straight out and point your thumb down. Then move your hand to the opposite hip. This again will pinch down on the structures that are below the shoulder blade and will cause pain. Make sure to do both tests on both shoulders in order to compare the good shoulder to the painful shoulder. You may also have pain sleeping on that shoulder at night. But what causes this to happen? If you have rounded posture in your back and your shoulders turn in, then this decreases the space in your shoulders that sit right underneath that shoulder blade that comes up here. So during shoulder movements, you pinch down on those spaces because that shoulder blade is moved forward. So what we need to do is open up the front of the chest and strengthen the back part of our muscles that support that shoulder blade and the rotator cuff muscles that bring your shoulders back into a proper alignment. The first stretch you're gonna do is a stretch on the foam roller. If you have a nice, hard, firm foam roller at home, perfect. If you don't, I would take a towel and just roll it up. So you're going to come over to a harder surface, so a yoga mat on the floor is best. A bed is probably too soft for you. And you're going to place that foam roller or that towel roll right at your upper back. You're gonna support your head and your neck with your hands. You're gonna bring your feet towards your bottom. You're gonna bridge up and you're just gonna roll on. You're just gonna roll on that upper back, going back and forth. You can play with bringing your chin to your chest, but you should feel a nice little massage in the back of those shoulder blade muscles. If this is pretty painful, that's pretty typical with getting on the foam roller at first, and you may notice that you have little tender spots. Those a lot of times are trigger points, so if you just roll nice and lightly over those areas a couple times with more repetition, it should get easier and nicer for you to tolerate. The next exercise that I recommend is for you to do shoulder blade pinches. So essentially what that is if you think about those shoulder blades on the back, you're going to contract your muscles so they come down and back, almost like they're going to your opposite back pockets. So in order for you to do this, you're going to think about that spine you're going to squeeze those shoulder blades down and back, pinch them, hold for about 3 to 5 seconds, and then relax. And again, squeeze down and back towards your opposite back pocket, hold for 3 to 5 seconds, and then relax. This is a good exercise that you can do while you're sitting at your desk, or if you're standing and doing dishes and you tend to get into that hunched over position, just get yourself back there and really open up those shoulders by squeezing those shoulder blades down and back towards your opposite back pockets. Do about 10 to 15 at a time, and if you can do 3 to 4 sets throughout the day, that will really help to open up that posture and give you more space in that shoulder joint. All right, for the next exercise, we're going to again target your traps and your rhomboids by using a Swiss ball. So I'm going to have you come down and you're gonna lay your tummy on that Swiss ball and then extend your legs out. This is a little bit of a balance trick. I wanna make sure your feet are out wide enough so it supports you and you're not rolling all over the place. Next, you're gonna start with your hands palm down, and again, you're gonna squeeze those shoulder blades down and back, going towards those opposite back pockets, and you're going to hold it up there. You should get a little extension in that chest. Make sure that you're not looking straight up or up at the ceiling. That will cause a little pain in the neck. So keep that neck for the most part in neutral. You're gonna hold for 3 to 5 seconds and then come back down. The slower you go, the harder those muscles have to work. Come back up, squeeze those shoulder blades 3 to 5 seconds, and then slowly lower down. With this exercise, do 3 sets of 10, but you might fatigue easily. So you might want to start with 1 or 2 sets of 10 and then take a rest break. And if you can do this at least once a day, that will really help to open up those shoulders and give you good posture alignment. So for our next exercise, this is a progression from doing those shoulder blade pinches, holding the shoulder blades down and back by adding a little resistance. I have here a resistance band, and what you can do is tie a knot in the middle of it and put it into a door, shut the door, just make sure nobody is gonna open it from the other side. Another thing you could do is if you have a pole or a banister at home, you can just wrap it around that banister, something nice and stable that won't move and won't shift that band. Then you're going to hold the band with both arms extended, and the shoulder blade is gonna lead the way. So you're gonna squeeze those shoulder blades down and back and pull so that those elbows come right to your torso. And then release. The next exercise that I would also have you do is almost the same thing. You're gonna take those resistance bands, and this time you're gonna pull down towards your hips, and I want you to squeeze those shoulder blades down and back. This one is a little bit more difficult, so you might have to loosen up on your band a little bit. And again, lead with those shoulder blades down and back, pulling towards your hips. Hold for 2 to 3 seconds, then come up. And I would do 3 sets of 10 with this one as well. So we're just re-educating those shoulder blades to work and bring that shoulder backwards so that it prevents you from going into that forward motion. So these exercises are a good starting point in order to correct the alignment of your shoulder and your posture. I want you to stay with your arm below the shoulder joint initially, especially if you have a lot of pain and weakness going up over your head or out to the side. You should start to notice that the pain will slowly start to ease off, and you might be able to start tolerating sleeping on that shoulder. If you're not seeing much of a change, please reach out to your local PT that can examine you further and make sure that there's nothing else going on. If you enjoyed this episode and want to learn more about the types of shoulder pain and what to do about it, please make sure to subscribe to this channel, then click on the video where I show you how to strengthen your rotator cuff muscles. Until next time.